Great, thank you to you both. And I think you've raised several topics that are going to come up both throughout this panel and then probably in the next panel as well. So I'm going to start with a set of questions around just a general reflection, and I think what I'll do is start with the budget people, on what role you see. So if you think about all the factors that can influence decision making in the budget process, how much of an influence do you think economic evidence has, and which types of evidence is most useful? How does it get used in that budget process? So Barry, you're looking at me questioningly. I'm going to throw it to you first.
I'll take what may be an odd view, but it echoes on what Henry just said. I believe he said something about a sharper focus on evidence because of fiscal restraint. People who are interested in using the economic evidence ought to love the sequester. By that I don't actually mean the sequester. The sequester is an enforcement mechanism, but rather I mean the caps, because the caps put a restraint on it and force the system to take a look at what works and what works better. Is it always successful? No, it most definitely is not. But it generally, I think, moves the ball in the right direction. The limited resources that the caps do on discretionary funding force the use of economic evidence, I think, more than in an uncapped world. The second thing I'd add to the budget process is we have moved more and more to this in recent years, and we're very much there now, looking over the long term. Again, Henry also talked about savings versus cost avoidance. Frequently, that can't be measured in the annual budget, because both the savings or the cost avoidance are things that occur only if you look over a longer term. So the political process is gradually getting there. It isn't there yet, but it's gradually getting there. The president's budget, the budget resolutions, the budget committees are now regularly doing measures and budgets that go out 10 years. It wasn't too long ago that it was 5 years. And when I first started at OMB, it was 1 year. And now there's even a call to look at things broader than 10 years, taking a look at the second 10 years. And if you're looking at programs that benefit children, youth, and families, you almost have to look at it in an intergenerational mechanism. So with that, the idea of the caps and how they can promote the use of economic evidence, and the idea of going out over a longer term, I think are two positive trends. One negative trend, I would have to say, though, is more and more economic evidence. Perhaps this is a reflection on society, not the producers of economic evidence, emphasize the uncertainty of it. They couch the language in such terms that you have to have a PhD in economics and actually to cull just what the report is saying. When I was at CBO, we dealt with a lot of economic uncertainty. We saw something that the Bank of England was using, where they didn't do a point forecast. Instead, they had a means of central tendency and then a wide range behind it. So we started doing the CBO reports with our staff derogatorily call them either a hose chart, where you do a hose and it spray out, or a fan chart. We started doing them. They were an unmitigated failure. The Congress didn't deal well with uncertainty. We'd do these things and we'd say, the 95% probability limit of the unemployment rate is X, and it didn't last. What they wanted to know was, what was our forecast of the unemployment rate 5 years out? And of course, we had no more certainty than our predecessors or what the economic profession has now, but we couldn't avoid it. We still had to do the point estimate. But the thing for this group to recommend is that the more concrete the studies can be, the less uncertainty, even if that means a smaller focus, the better off they are. The political process just doesn't deal with that amount of uncertainty very well.
So can I reflect back? So is what you're saying that, thinking about the different inputs that go into decision making, that the degree to which, I don't even know how to say this, that economic evidence is going to get wiped out by the political process might depend on how specific that evidence gets? Is that what you're saying, even if it's less accurate?
Well, again, this session here, and sort of I was reading the background materials that I got, has this phrase, economic evidence, as if it were a one solid thing. Oh my gosh, we've done it now. Now we have the economic evidence here. Well, that isn't the way it works. It isn't the way it works in either academia or in the budget process or in the political process. I started at OMB in the Carter administration, and my areas that I started with at that time were subsidized housing for the poor. And an effort that had started before I got there and I was actively involved in and eventually proved fruitful was a conversion of the mechanism to assist the poor from public housing, where the government owns and operates the housing, and it had shifted to a mechanism that provided assistance to the tenant in a unit. In other words, it was unit-based. But what we were doing was using economic evidence to say that the problem with getting poor people housing isn't the housing. It's the fact that they're poor, that they needed a supplement to their income. But once they had a supplement to their income, we used the V word at that time, vouchers, that once they had a supplement to their income, they could maximize the return on the dollar. That is, they could choose where to live that was best for their families, for their jobs, for their transportation, for their schools. Instead of having the government says, okay, we'll help you out, but you got to live here.
So I'm going to toss this question to Henry in just a second, but I want to ask you, Barry, what kind of economic evidence did you use to make that decision?
It was a long-term studies done primarily, funded by the Department of Housing and Urban Development, funded and performed by the RAND Corporation. But that one of the reasons I'm pointing this out specifically with your question for uncertainty is that this series of studies started, I've forgotten now, in the mid-'70s or late '70s. But it took several years of going back and saying, okay, you concentrated on this factor, now you have to concentrate on another factor. In particular, one of the factors were the distrust of giving poor people money or vouchers. They'll use it unwisely. They will not buy housing that meets minimum standards, running water, heat, no rodents, that type of thing. Well, it took a while to study it. And the more we studied it, we found not only did poor people use the money wisely, but if you looked at it after several years and you took a picture of public housing or other subsidized housing and voucher housing had better quality. Why? Because the governments didn't spend enough time on it, and too often you would get ghettos. But that wasn't quick, and that wasn't the first thing we studied either. So it took years. And then one of the things I'm trying to point out on this, it took years for us who were at that time, again, my job was at OMB at that time, but to convince the political system, because they continued to ask questions about this. And we continued to say, you just don't want to maximize the number of new subsidized housing units built, although that really can mean a lot to your contributors or things like that. What you want to do is see, particularly after a couple of years, how well people are obtaining housing services, broadly defined, with the assistance that they get from the government. It wasn't short-term and it wasn't easy.
Okay, thank you. So Henry, I'm wondering from the state perspective, if you could reflect on this question, Henry and Eric, sorry, of what role economic evidence plays in your decision-making at the state level and setting state budgets, and which type of evidence is most useful to you in that kind of decision-making?
Yeah, sure, thank you. I think we try to use from as wide a sources as we can, including the performance of our own programs. Maybe I could share two concrete examples that we're working on right now. So we requested additional resources for affordable housing it's topical. It's interesting. Barry mentioned that issue too, and we've been adding minuscule amounts of money in the scheme of things because the state role in this space in Colorado has been fairly limited. So since we're early into this, we had to use evidence from other states. Obviously, the advocates of the program, that becomes a way of having a resource of knowing what evidence they use to advocate for the program itself. But we used, just one study talked about the economic benefit of construction, and then we didn't actually have a lot of compelling, here's your perfect cost benefit analysis. So what we did was, given the population that we were dealing with, whether it's seniors or moms with kids or whatever, we tried to do a break-even analysis. So for the seniors, what we said was, how many seniors receiving a voucher, if they avoided a nursing home situation, would it take to break even? And it was something like around an eighth or 1/7 of the vouchers. If those went to people who would have otherwise needed a Medicaid nursing home situation, the entire thing would break even, and then everybody above that. So, a big majority of the dollars would be profit, in quotations. Another project which has some prospects for success this session is subsidizing long-acting reversible contraception. We received a grant from a philanthropist a couple of years ago to do this on a volunteer basis with low-income girls and women. And the results were amazing. 40% drop in unwanted pregnancies, and you can translate to that group how much would that have cost into the Medicaid program. So touching this issue now is all the politics around contraception and whether or not they cause abortion or not in some argumentation. So we're dealing with injectables, and we're also dealing with IUDs. And so we had a program. It had extremely compelling evidence. It was a program here in Colorado. We could duplicate the structure, but there's a little bit of an uphill climb on this one.
Thank you. So I'm going to follow up with asking Uma, Nadia, and also Danny, I'm hoping you can speak to so at the level of implementation and thinking about strategies of policy implementation, so there's sort of the big picture budget questions, but then which strategies are local communities or local implementers using, schools? How do you see economic evidence playing into that decision-making process, and what do you see as some of the challenges there?
So this is Uma. In our community, we have, I don't know how many of you are familiar with Montgomery County, but we're a suburb of Washington, D.C. And over the last 15 years, our demographics have shifted very significantly. We've become browner and poorer. And we use this data point a lot. 33% of the population in our school system is eligible for free and reduced meals. And now 82% of that 33% is actually eligible for free meals, not reduced meals. So this is a very clear statement of growth in poverty. Over half our county's budget is used up in education costs. And education is a very important value in our county, and education and public safety tend to be the two, and then transit nowadays, right? Health and Human Services is a little lower on the scale. But the question keeps coming up on the educational achievement gap, and Nadia, you kind of appreciate this. The conversation is always, why is there a broadening gap for Latino and African American children? And this conversation about how can the social determinants question, whether it's in education or it's in health, and I thought those comments around, what can you influence versus what can you control is incredibly important in this discussion. Is there a way that we could wrap around services to reduce these social determinants that impact educational achievement? And when you talk about that, that's often domestic violence, mental health issues in the family, incarceration of parents, unemployment. I could go on and on, right? Homeless, housing instability. And so we started looking for models of what is it that we can bring, we as in health and I'm telling you, this is like a high point in my career. The second week of my job here, the school board president, the superintendent, and the committee chair for education came to my office and said, we're seeing all these educational achievement gap issues, health and human services, what can you do? And I was like, how high do you want me to jump? It's never happened, right? How exciting to be able to work with children and families well before much more upstream. And that's the conversation at the local level. How do you get upstream where families are not in crisis? How do you wrap around children? The school system is doing some very exciting work on what they call early warning indicators, and they're for graduation. And all their stuff is around education, but when you look at a child who's truant in first or second grade, it's not the child who's truant. There's something going on in that family. How can we step in? And so this conversation about what are those resources that we can bring to bear, and where do you actually see the evidence? And this is a very tough one for us. I'll use another example, which is in health. If we were to work on obesity or cardiovascular diseases or strokes or any one of those issues, who would see, if we did a diversion program from emergency rooms and got folks connected to primary care docs, who would see the benefit? It would be the hospitals, who have a huge incentive right now with payment reform and everything else to reduce readmission rates. Terrific. So unless we can influence community benefit and get them to put the money back into the system, and if you don't have a cost-benefit analysis that shows what's the value added for you in it, we don't make that case very well. So on both fronts, I think, on education and in health and human from a health standpoint, I think if you don't pull the economic evidence, you're not making the case for the investments to be laser focused. If I'm going to county council and to my executive and say, we're going to do this particular initiative with these kind of wraparound services, and this is the upfront cost, and if we don't do that, here are the downstream costs, but we may or may not see those downstream costs, it's a very difficult argument to make in a time of recession. Because what everybody expects, and this is the heart, I think, really at the heart of it, everyone's very happy when you make the savings argument, but before the savings can be reinvested in the system, there has to be an upfront investment that will yield the savings. So you've got to be willing to make that upfront infusion where you may actually double book the money, or you may have to double the investment, but then you could recoup it, and the model has to be tight enough to show the recouping, but there is not often the willingness or the capacity to do either.
So if you could, just staying on that for a minute, thinking about where you pull that evidence in to make that cost benefit and that estimate to then take to argue for this new approach, what are some of the challenges you see in the literature or in finding the evidence you need to make that argument effectively? Putting aside the fact that then finding people who are willing to put that upfront money in is a whole other political challenge, but thinking specifically about the evidence you would draw from to make that argument, are there things you're seeing in your your generator model that you said you have?
So just to use the calculator that we built, it took several $100,000 worth of grant money from the federal government, bringing in Johns Hopkins Public Health Informatics to help us, and Accenture. Right? We did not internally have the capacity because the budgets are experience-based, so there is rarely, you cannot tie it to, it's very hard to tie it to a unit of service. Having said that, once the calculator is built, do we have the capacity to do it? So all our funding, by the time it gets to local government, there's hardly any evaluation money. There is hardly any capacity to do analytics. We scrounge, right? We literally scrounge. I mean, to do our public health, Healthy Montgomery project, which is our community health needs assessment, we went to our hospitals and we said, this is the value we can bring to you in your community benefit IRS reporting process. Give us $25,000 each. And we got money from all of our 6 hospitals, and that's how we're funding some of the analytics capability to do the public health analysis. But within, quality assurance is largely output driven. It's not even terribly outcomes driven at the local level. It's very challenging to do this. So I don't have $300,000 every time I want to fill out the calculator to go build the capacity, which means at some point it's going to become more nimble than it is today. We also have to consciously, I think, and I haven't succeeded in this, make an argument to budget folks and policy folks that investing in analytics in local departments, or any department really, beyond just the quality assurance side of the house is extremely important. And that's been a struggle. And then the third is I don't know that anybody really wants to hear it if it means you have to put more money now. So they're willing to, they love it. When I go talk about it, everybody loves, oh, wow, you've pulled this off. Because I could tell you based on that calculator, a pregnant teen today, if you do not deal with her issues now, all the issues that are presented, she drops out of school, all the things that happen, she's the homeless mom of tomorrow at 21, 22, 23, sitting in the shelter and the motel with a GED or less education without the income capability. I mean, I have the data, I can show it. Does that mean that more housing units are coming my way necessarily? No, but everybody wants to engage in the discussion. Maybe that's progress, right?
And is the data going into that calculator largely your own raw data? Is it data coming from research studies, or is it a mix of things?
It was all of it. But what we tried to show with our calculator was that we picked 2 interventions. You can't pick too many variables. It makes it very difficult to populate a calculator. So we picked 2 things. One was an integrated case practice model because we're an integrated health and human services department, and the technological frame, an integrated case management system that will help us see these clients across the enterprise and to see where they're getting mental health services, where they're getting domestic violence, where they're getting TANF, SNAP, child support, what was going on, childcare, what was going on in their lives. And so we were able to populate the information. So we did both, right? And the return on investment was a 1-year point in time kind of calculator. The social return looked 5 years out. What was the benefit to the client if they were stable and if there were certain things happening in their lives in terms of economic benefit and all of those things? And the second part of it, the 5-year analysis was much more difficult because you really have to come back and look at what's the benefit to the community ultimately, which was the social return piece. And so that one was even hard for us to understand if we didn't have Dr. Lehman from Hopkins sort of walking us through. And sometimes he spoke language that we didn't get. He was so patient with us. There were times when he had to literally break it down. But there's so much value in this activity, but very difficult to pull together.
Dan, I'm going to ask you both offered to share some lessons learned from the work that you've been doing around evidence at the federal level, and I was going to ask you if you'd be willing to share those with us now, and then I'm going to open it up for committee members to ask other questions if you have any.
Sure, so a few thoughts. I think this work is extraordinarily exciting. I think there's a little bit of a risk that you can kind of get swept up in the excitement and think we're just going to evaluate the bejesus out of everything. And how and what you evaluate actually really matters. So we actually really have to pick the right tools to generate the best evidence about a very particular set of issues that we are trying to solve. And so if we paint everything with sort of the same brush and set the same set of expectations of this is the kind of evidence and this is what it needs to show us and otherwise it's no good, it's just we're not going to get there. And actually what we're going to do is we're going to really sort of set ourselves back pretty significantly. So, for example, if we're trying to figure out how you best organize a school district, and you want to know what that's supposed to look like, and how do you think about efficiencies in that, or you want to know how do you best prepare a current teacher who's been teaching for 14 years how to teach to a new set of standards, those are very different kinds of endeavors, and the kinds of evidence and the kinds of incentives that we want to use to encourage people to take that on are going to be quite different. And I think we have to be very careful about generating sort of bad information and worse, kind of a set of faulty expectations about what is and isn't possible, which will kind of land us right back where we started, where everybody is sort of dubious about this enterprise and sort of thinks it's just another way to kind of stamp people right and wrong, kind of good and bad, which really takes us away from this sort of learning ecosystem frame that I think is really important around this work. So that's the first one, is just sort of how and what you're doing actually really matters, and contextualizing your tools for the problem you are trying to solve is extraordinarily important. And I think Dan's opening comments when he said, we sort of started out thinking about how do we do a bunch of evaluation and then kind of transition to a kind of much more nuanced assessment of what are different things that we can do to kind of change some of the incentives at the federal level, at the local level, is really important to that point. I think on the cost piece, I would just add, I think we are still even earlier in that work. And so we very much have limited comparable information about what current practices cost. So we're sort of now in a universe where people are trying to say, how much does this new thing cost? But we don't have very good information about what the current thing is. So if you want to, if you have a program that trains principals, within 10 years of somebody going through that principal training program, 60% of them become principals, and of those, some proportion are really outstanding school principals. How much did that cost, right? And sort of like, how do you think about what that looks like? And we don't yet have that information. And so our task is to sort of encourage the new folks that are thinking about how do you train that principal differently, to capture that information, but not also to sort of hold them hostage or sort of say we should also have all of this other information that we don't yet have and compare it to sort of imaginary things, and sort of to do the work that it takes to make sure that we get the information we need to really be able to assess whether we are making the best possible investments. And then I would add, from a federal lens, there's often this question for federal program, it becomes the question of, does something work, becomes a question about whether does a particular program work. So does a particular funding stream work? And a funding stream, I think if people are doing relatively homogeneous sets of activities, you could probably look at, does that funding stream work? But in most cases, people are actually doing a huge different range of activities, where we sort of say, okay, here's some goals, and people are doing a bunch of different things that are appropriately attenuated to their own context and to their own environments and the own populations that they are serving. And so we are sort of, in essence, asking the wrong question again, which goes a little bit back to my first point. And I think the question isn't, does such and such gigantic program work or not? But rather, what are different sets of practices that solve persistent challenges? So Uma, to your point earlier, on dropout prevention and achievement gap, there's actually a kind of growing body of evidence that says here are a few different things. So Dan's former colleagues at UNC Greensboro have been doing some really interesting work actually around this, with early college high schools, where they actually have a model that helps students from low-income backgrounds and students who would be first-generation college goers graduate from high school in sort of somewhere between 10 to 20 percentage points higher rates than other students, which is pretty high in our world. So percentage points higher, not percentage higher. There are the folks at Johns Hopkins who do a lot of work around the early warning indicator systems. And in an ideal world, we would be in a system where you would say, I have this challenge around these achievement gaps. Here's what my kids look like. Here are the resources I have. Here are a sort of menu of different options. How do I figure out which one or two or three might be best for me? And sort of how do I go forth and do that work? There are lots of things that get in the way of that. And so I think we have initially sort of focused on how do we change some of the incentives in the system. So how do we give UNC Greensboro or Johns Hopkins or other folks the extra money that they need to scale their model, to learn more about it, to share that information. But just as important to give them the incentive to generate and use the evidence is just as important for us to give them an incentive to actually be transparent about their results. And this goes a little bit back, I think, to something that Eric may have said in his opening comments, which is if we're asking people to do this work, which we should be asking them to do this work, it is just as and we're asking them to share this work, it is really important to give them an incentive to be clear and transparent about it. And so to be able to say, we thought, we were very well intentioned, we had this model, we tried it, it didn't quite get us what we wanted to get, and that's okay, that the penalty isn't just now we're going to take away all of the homeless beds that you asked for, that actually we say, okay, well, what are you going to do to go back and do that differently? Because the need is still there, right? The population still has those needs. How do we help them do that work in different ways? And so we think we started by thinking about the incentives sort of at sort of this at a little bit more the micro level, right? How do we do it at a program here? How do we do it for one particular school district or group of school districts over there? But I think this question about how do we also kind of think much further downstream and change the incentives for sharing what people are learning is just as important important and perhaps even trickier.
I'm going to talk at a more basic level, I think, about, I think how evidence kind of plays a role in, I think, a lot of, decision making. And I think these kinds of conversations tend to be very dominated. Most of the people in the room tend to be more often the producers or very high-level consumers of evidence. And so I think it's very hard, for folks like us to appreciate the folks who are not evidence experts, how they go about making these decisions. And think about the folks who produce evidence, the world that they operate in. In particular, if they're, at, high-level, research organizations and academia, all these caveats, that Barry was complaining about. Why do we have those? Because if they don't address that 57th caveat, in the paper, and they give that paper at an academic, get somewhere, or they try to, give it, they try to get that paper published somewhere. There's going to be some editor. There's going to be some, there's going to be somebody in that audience who just drills them and kills them on not including that caveat. And so that is who most of our producers, I think, often are trying to address when they produce evidence, is that person who's just going to kill them. Because they don't see the person who opens up their, their paper and can't figure out how to make sense of it for a decision. They never see that. They see that person who's going to kill them at some conference. And so I think the thing to think about, and so what ends up happening is you have a lot of this research that is very hard for decision makers to make sense of. And so what do? Most people, I think, would like to use evidence. There are some that don't, but most folks would like to use evidence. So they have to go and find filters. They have to find people who can filter through all of this stuff and help them make sense of it. So if you're in the executive office of the president, what do? You call people from Harvard and MIT and whatever, and you help them, they help you sort through it. Although you don't pick them at random. You pick the people that you think are probably going to give you the answers that you like, and so there's issues with that. Maybe that's a problem. If you're in a state or local level, you're probably at somebody at a local university that you're picking as well. Again, probably not at random, and so there's going to be issues with that, and I think the other kinds of institutions that have been able to break through this morass in an important way are, the institutions kind of like, one example I think is the Washington State Institute of Public Policy or What Works Clearinghouse, that have created a system, a very imperfect system, but a system that folks can, over time, that are not super sophisticated with evidence, can learn what that system is telling them and what, maybe more importantly, what it's not telling them. And then they can adjust how they treat that evidence over time from that system in a way that, that gets kind of more and more sophisticated over time. But if they have to deal with every debate that we have in academic literatures on a one-off basis, they're never, folks are not going to be able to learn and apply that to the next circumstance. Whereas these systems like What Works Clearinghouse or WISP or things like that, I think give folks an opportunity to kind of learn over time and get a lot more sophisticated. And this is certainly true like with my work that I've done in the basketball world. For the first couple of years that I was doing that work, everybody was very polite. They always said nice things whenever I'd say stuff, but there was no evidence whatsoever that they were paying any attention to what I was saying. But over time, I kept presenting the same kinds of stuff in the same kind of ways. They learned over time. They learned to trust what I had to say. They saw some results of some of the things that I had said, and it seemed to work out pretty well. And over time, they grew to pay a lot more attention. And I played I play a much bigger role now than I did when I first started. And I think that's the process of how evidence ends up playing a role in decision making. It's not it's not like there's these, this magical evidence that's out there that everybody's going to agree to. I think you're building relationships. You have to build these kind of systems that, that I think can help filter this, to the folks who, need to make these decisions.
Thanks, Dan. That, I think, is going to be a nice segue for our second panel. Before we open up for public comment, I wanted to give our committee members a chance to ask questions.